morning. Okay, get your friends in. Come on, everybody. Get your coffee and come on in. We're so glad you're here. I'm Heather Gilker. I'm with Social Venture Partners Dallas. I also help run an impact network that's an angel network called Swan Impact Network. We are so excited. This is a really big moment for these entrepreneurs. I'm so excited for you all to have a chance to experience the Big Bang Fast Pitch. We've been doing this for the last 7 years that we've been giving equities. Before that, it was grant money. So this is an equity investment in these companies. A special thank you to the Portfolio Review Committee at Social Venture Partners and the volunteers who helped vet the applicants, the pitch contestants, and to help get them prepared for today. I'd like to welcome our judges up here to the stage. First, I'd like to welcome Dr. Stephanie Gripney. We're so thrilled that with all the wonderful folks that we've got here at the conference, we have these amazing judges. Stephanie, come on up. Thank you. I'd also like to welcome in town from Colorado. She's got some fun things to teach us all. I'd like to welcome local Jimmy Tran. Come on up, Jimmy. Thank you for joining us. And then I'd also like to welcome Melanie Audette to the stage. Thank you. We're so glad you guys are here. And the way this format will work, each one of our contestants has got 5 minutes to pitch the judges. The judges will ask some questions, and then we'll move on to the next contestant. Then the judges will go back and deliberate and come back and tell us who the winner is. And so we will just move right on forward with it. So first, I'd like to welcome First Then's founder to the stage. And by the way, you may notice they're all women.
Good morning, Upswell and Social Venture Partners. My name is Amanda Schnetzer. I'm the co-founder and CEO of First Then. I'm also the mom of this cute kiddo who was diagnosed with attention deficit hyperactivity disorder the summer between kindergarten and first grade. After 5 years in this frustrating ecosystem of care, my COVID moment was to channel my strengths in strategy and social impact to transform access to treatment with family-centered digital therapeutics. Did you know ADHD affects more children in the United States than any other pediatric mental health condition? That means the odds are really good that you or someone close to you has a family member with ADHD. Gold standard treatment is considered a combination of medication and psychosocial interventions. Unfortunately, less than a third of families may ever receive this second care component, which is so critical to a child's development of positive behaviors and executive function skills that they need to succeed in life. The costs and consequences of inadequate early care are profound for everyone involved, and especially for at-risk and underserved communities. In my case, we were a 2-income family living in one of the largest metropolitan areas in the country when our son was diagnosed. And even for us, it was challenging, frustrating, and expensive to implement the care that he needed. Imagine living in a community where there are no therapists, or where at a minimum $150 per hour for a single session of psychosocial treatment is simply out of reach. So we asked ourselves, how might we democratize access to psychosocial treatment for ADHD and help more families stick with it in the moments that matter most? Using design thinking and extensive customer discovery, we landed on 3 core components of an innovative mobile treatment application. First, self-guided training and practice tools for psychosocial interventions like parent training and behavior management. Second, an empathetic AI chatbot for personalized coaching and support. And third, self-care and coping strategies for caregivers who battle with the added stress and strain of parenting a child with ADHD. Every lesson, tool, and chatbot interaction is rooted in the science of positive behavior change. At First Then, we're sitting at the intersection of rapidly growing markets for youth mental health and digital therapeutics. We're also responding to an urgent need for scalable, affordable, and accessible solutions for families at scale. At First Then, we're committed to serious science and to getting that science out of the lab and into the marketplace as soon as we can. Our next major milestone is to complete version 1 of our app and launch our first pilot with the largest independent network of primary care providers right here in the state of Texas. And I'm really proud to announce that just yesterday, the National Science Foundation awarded us our first SBIR grant. Thank you. So you may know, the global pandemic brought with it increased interest and investment in youth mental health, and that's a great thing, and especially investments in telehealth. At First Then, we're working to push past some of the limits of telehealth with self-guided, family-centered solutions that can work and function on their own or integrate seamlessly into existing larger models of care. The way we get there is by launching first direct to families with a subscription-based business model. We'll then expand with children's health centers and large self-funded employers and other B2B customers. I'm really proud of the multidisciplinary team that we have assembled that has both the passion and the expertise needed to develop innovative solutions to a massive societal problem. And we've got very engaged and active advisors with expertise in research and clinical practice, in technology and digital therapeutics, and in the business of healthcare. We've raised $150,000 in angel investment, and yesterday received the National Science Foundation grant. We're still looking for strategic partners, advisors, and yes, investors to help us accelerate and move our innovation forward. So if you have a heart for ADHD, or you've got a strategic interest in democratizing access to healthcare, I'd love to talk to you and begin a conversation. Thank you so much for your time and attention this morning.
Thank you so much. Next, I'd like to welcome FreezeKnit to the stage.
Is that me? This is not my slides. I don't know. Maybe I'll go back. Nope. Sorry, I wish this looks delicious. I wish this was my slides, but it's not. Cool. Oh, nice. That is me. Hi, I'm Joanna Shu. I'm co-founder and CEO of FreezeKnit, and we're developing an innovative non-toxic treatment for head lice that uses only cold CO2 gas. It's not. Do you think I could get a technical person, maybe a little assistance? Sorry, it's not moving forward. It is on one screen and not on the other. Nobody? That's cool. So I'm a mom of 3 kids, and they've all had head lice more than once. And each time I was surprised at how difficult it was to get rid of the head lice for good. But it's really common. About 1 in 3 kids will have head lice at some point. Nice, there they are. Those are my 3 kids. And it's really difficult to treat. American Academy of Pediatrics estimates that about $500 million is spent on treatment each year. And unfortunately, this big treatment burden, it's not felt equally by everyone. So it mostly affects girls. More girls than boys get lice, usually due to longer hair. And it's usually the household CEO, i.e. mom, who has to, drop everything from work, go pick them up. And often kids are kept out of school for up to a week. Therefore, mom's out of work for up to a week. And minorities, more often than not, are likely to get skin irritation from the irritating products on the shelf. And the black hair is 10 times more likely to break due to harsh combing and chemicals. So like I said, current treatments are pretty terrible, usually involving hours of combing, pesticides, or other random goos. And what's worse is that lice have developed resistance to most of the popular products on the shelf, so they don't even work anymore. Which slide am I on? Nice, that one. And that's why we developed FreezeKnit, because we think we can do better. FreezeKnit kills head lice and nits in one short treatment using only cold CO2 gas. It works because lice are like us. They're mostly made of water. And so when they reach their supercooling temperature, they explode. So it's hard for them to develop resistance to that. We have a working proof of concept device that was developed by the engineers at UT Dallas. It's chilly. It reaches about 14 degrees Fahrenheit, but it's tolerable for 15 minutes, and most importantly, it's safe for kids. And just to put that into perspective, chemo patients who are undergoing cold capping for chemotherapy, that's about minus 35 degrees Fahrenheit for 6 to 8 hours. So as our treatment is much warmer and a much shorter duration, we do not anticipate any negative side effects on the hair or scalp. So we plan to bring this product to market as a service, available at urgent cares, pharmacies, health clinics, and specialty lice salons. And treatment's done in under 15 minutes. So after that, you go home lice-free with no special shampoos, combing, or creams needed. So each location would have a one-time purchase of a base device, and each patient or customer would be treated using a single-use bonnet and gas cartridge. Freezing is better and faster, and our competitors fall short for several reasons. So Nix is the market leader far and away, but it no longer works on super lice, and the chemicals inside are banned in many countries, including the EU. Dimethicone-based serums are very messy, can take up to 5 applications, hours of combing. It's been compared to motor oil. Lice salons are expensive and time-consuming, and prescriptions also are, while effective, they're expensive and can be irritating to the skin and eyes. So we have 2 pilot sites who've signed letters of intent to test our existing base device and next generation bonnet. These will be small-scale, non-significant risk studies. We filed a provisional patent. We're in the process of filing for additional uses, as well as converting our patent through the PCT. We expect classification as a Class 1 medical device by the FDA. And next year, we will begin our pilots, like I mentioned, and final device design and production. We also just completed the 2023 program at Health Wildcatters out at Pegasus Park. We were part of the cohort. So great ideas attract great talent. So my background is in consumer products. I developed my own skincare company, Refresh Skin Therapy, and we got our products distribution worldwide through major retailers such as Costco, Sam's Club, Walmart, and Rite Aid. My co-founder, Dr. Carol Spangler-Vaughn, has been in the life science research field for decades with a focus on cancer treatments, and our IP comes directly from her research. So we're raising $1 million to bring this product to market, and our roots are in Texas. So I'm from Houston, my co-founder is as well. Like I said, we were at Health Wildcatters. So we're looking to keep engaged with the North Texas community, whether that's investors, partners, key opinion leaders, physicians. We want to stay involved here. And so Freezing It, in short, is developing an innovative treatment, improving treatment for the millions of children who get head lice each year. And if you don't remember anything else about me, remember that Freezing It kills head lice and nits in one short session with no harsh chemicals. Thank you.
Okay, judges. I got so excited to be here, I forgot to allow Q&A for the first contestant. We'll bring her back at the last, judges. I know you're kind of wondering, hello? Okay, so Q&A.
I just want to, let's give her a round of applause for her poise. For those of you who have not pitched and had your AV go bad, and that was nothing to her, she didn't do anything wrong, you were excellent at being on the fly. So great job on that. You've done this before. How is this different to what you've done in the past, and what are your biggest challenges about bringing this to market?
Mm-hmm. So with skincare, it was much easier, faster. You know, you develop a product, you shop it around to buyers, try to get it on the shelf. This we have to, we have to really show it works, and to get physicians to buy in, to get parents to buy in, we have to show it's safe. It's CO2, so most people have maybe some kind of CO2 in their household, or if you've ever used, a Coke machine or a soda stream, that's CO2, and that's the canister that UT Dallas used in our prototype. So we think it's safe. CO2 is applied topically all the time in medical applications, but again, when it's your kid, that this is different. So we have to show a little more, safety and proof, and talk to doctors. My mom's a doctor, so I know they can be a squirrely bunch, and so, so yeah, it's different. But we still need to talk to, direct to the consumer. So some similarities.
Any thoughts on, for minority and low-income groups, barriers to getting to a facility and getting treatment at a slightly higher cost than over-the-counter?
Yeah, and that's part of our ask. That's why we're here, because I don't have a great strategy for that, but I'm hoping there's a nonprofit or someone here who might, because the people who need it the most, the $80, that can be a barrier, right? And the people who can't afford those days off from work. And so I'm hoping someone in the audience here would come up with maybe we can brainstorm some strategy. And then over time, in the beginning, we have to go with obviously who can pay, because it's, we're small. But then as we grow, maybe Medicaid reimbursement, that's on the table. But.
So so thinking through that a little bit, tell us what happens to a woman of color with a child who has lice. Like how many hours does that cost her right now in terms of how she deals with it? How is that what's the customer journey for her right now with lice?
Sure, I think the estimation, just for everyone, is a $6 to $8 billion cost to the economy every year for keeping parents out of work. And so if it's a week of work and you're maybe, job is not as secure as you would like, that can be the difference between being like, well, she's not reliable. So that's a big risk. And it's,
So last year I was talking to Hackensack, it's in the Northeast, a hospital, and they spend $50 million a year for people who are uninsured coming through their hospital. And she was very open, the CFO was very open to anything that would reduce those costs. So you could think about short term, like going your B2C strategy, but mid-long term, looking at a pay-as-you-save strategy. Map who the people are, who you are going to be saving money, the employers, the hospitals, the school districts, and say, if we are able to reduce the number of incidences of lice every year, or the days that people are losing, we're going to be saving you this much money. So we'll bring impact investors separately to the situation, and they'll pay for the caps up front for the low income, the people experiencing low income. But if we see a reduction at the school district, we see a reduction of people coming into the hospital, we see a reduction as an employer, we want you to pay us for that success.
Yeah, I think that's great. Yeah, and am I done? My son has ADHD, so I was interested in First Then. But when he misses one day of school, it takes us 3 weeks to get back on track. And so a week out of school is devastating for a lot of families.
Efficacy. Are there reoccurring incidences? Did you have to go back? Can you talk a little bit more about what you've seen there?
Sure. So that's what's great about freezing it. It's a single treatment. Most treatments out there are 2 treatments, and that's because they don't kill the eggs. So you have to wait for those eggs to hatch, then you go back a week later, or sometimes again and again. So we freeze the lice and the nits in one treatment, so it's a single. And that's also a reason why you can go back to school right away. And keep in mind, during that week when they're hatching, that's an active infection that you can be spreading in your household and to your friends and family. So I know, gross. I hope you enjoy your breakfast. Okay.
We just want to thank you. Excellent job.
Thank you. Thank you.
Thank you. Next, we'll welcome Cook's Nook to the stage.
Hi, good morning, Upswell, and I heard you already saw my slides, so. So I am Joyce Chevalier out of Austin, Texas, and we are the Cook's Nook, and the Cook's Nook is a nutrition solutions provider in a variety of segments. We're going to talk about that very quickly. Did I go the wrong way? I did. So just a short story. In early 2020, I was actually quite sick with COVID. Not a shocker, in February, March, and what I saw was a bunch of food, a bunch of calories being passed as food that a lot of people were receiving. And I knew as a former diabetic that if I had eaten any of the stuff that was being provided to people who really needed things, I would have been in a world of hurt. I couldn't have eaten those things. And as I lay there as a product manager and technology product manager, I sort of thought, I have to be part of a change, something else that's happening. And as a result, created Cultura Cuisine, which is actually a medically tailored meal and nutrition solution to be used by healthcare, by cities, counties, and governments to actually work in the communities and improve outcomes, health outcomes in those targeted populations. We know that in a $4 trillion healthcare system, that we already know from a variety of studies and from common sense that actually if you can actually improve the nutrition provided to folks who have specific health conditions, that diet-related disease could actually reduce costs about $13.5 billion in this system. And so what we've developed, as I mentioned, is a medically tailored nutrition solution. And when we talk about that, what does that look like? One of the key elements is that it is culturally relevant. People have to actually want to consume the nutrition that you're providing to them, that you're trying to put into their communities in order to achieve the outcomes that you're looking for. And that's what we've been doing. Almost 2 million meals across Austin, Dallas, and now we've actually moved into Louisville and to Houston. Just a couple of notes. One of the big opportunities that is happening is the fact that CMS, your Medicare, Medicaid system, is actually changing. Food used to be seen as a bribe, and nowadays nutrition is actually seen as a solution, as a critical part of solution for insurers and for governments in order to achieve these outcomes and reduce cost of care. Where we're seeing traction right now in the company, we've actually spent the first 2 years, we've been at this about 3 years. The first couple of years, we were very focused in government areas, municipalities, and your CBOs, your community-based organizations. These days, we're leaning very much into healthcare, and we're having traction with your benefits providers, but also the care providers, the hospital systems themselves have been reaching out to us in order to implement nutrition solutions for them into the targeted populations. And then lastly, at the bottom, you can't see there, but our ultimate end goal is to actually be in the healthcare plans and actually have the insurers help them have the tools to provide these as part of their offerings. And what is Cultura Cuisine? At the bottom, it is our medically tailored meals for diabetes, for renal patients, also we have nutrition for children as well. But we have our meals program along with our elements, which is our cut vegetables and grains, grain forward, and also our to-go, which means you could take your nutrition with you. And then our digital platform, which is our Foodways. We combine all of these to create the solutions that our partners are looking for. That is not only the construct of the nutrition for that population, but also the metrics, the distribution model, and eventually the outcomes and impact. So we actually work with them to actually create something that helps them get towards health equity. And a few of our partners here, hard to see on the screen, but of course Ascension, fourth largest hospital system in America right now, is actually using our program for maternal health. And of course you guys are aware of the numbers right now and maternal mortality rates, low birth weights for infants and babies. And so they're actually using our nutrition program to improve outcomes for postpartum mothers, for example. Why us? Well, because we actually represent and actually come from the communities that we serve, and therefore feel very confident about creating equitable approaches to achieve those health outcomes in communities. And we're scaling across the U.S. and working on our impact as well. Just a few numbers from Travis County itself, where, like I said, we see high rates of satisfaction in the community, and that we're a very experienced group coming out of sales, technology, you name it, operations. And then the last thing is that we currently have a round open. It is an angel round that is still available. We also have partnerships with some of the leading funds across the U.S. It has been $1 million round, and we're getting close to that. We would love to bring you along in this change that's happening. Thank you so much.
All right, thank you. Now stay here. All right, we've got some Q&A with the judges.
Absolutely.
Thank you so much for
Ah.
that great presentation. Can you tell us a little bit more about the manufacturing and
Sure.
distribution? Thank
Sure, absolutely. So currently, everything is produced in our teams in Austin, Texas. We actually work with registered dietitians, and my background additionally is also in foodways and cultural foodways. So we actually have a nutrition set that is actually very broad and expansive. The unit economics to that are incredibly important, and so having a very large access to a variety of products in the supply chain allows us to very much manage those unit economics and still bring culturally relevant food and cuisine. Everything is produced in Austin. We do LTL shipping in our units to Dallas, eventually now to Kentucky. And so when we talk about distribution, yeah, it's typically shipping, though some programs may choose to actually do to the door to clients. It just totally depends on the construct of the program. But we handle all of that as well.
Just to follow up on that,
Yeah.
is it a ghost kitchen model, or do you own the
No,
facility?
no,
lease?
I'm the owner and founder, so I own everything. We actually produce everything in Austin, Texas, not a ghost kitchen model. The facility actually is also part of the company. And so we're the manufacturer.
One, I'd love to connect you. There's, you have several friends, I'm not going to call them competitors, around the country, like Bandadosa in Denver, Colorado, that's doing last mile food delivery in this space. What would be incredible is to get a bunch of you together, and some people don't realize there are foundations, but there's a specific kind of foundation called the Health Conversion Foundation. There's 30 to 40 of them.
Okay.
So they're foundations that were created when hospitals went from nonprofits to for-profits.
Right.
And I think these 40 health conversion foundations, 35 to 40 of them, would be very interested in all of your models.
Yeah, thank you.
And what's great about my mom, I'm a daughter of my mother was a dietitian in food service and health in hospitals and schools. And whenever I think of disease, I think of why aren't we racing for the cause versus the cure? And your solution races for the cause. And so it would be really interesting to get a national conversation with 10 other actors like yourself with these health conversion foundations and say, hey, what can you do to accelerate the adoption of this into the distribution networks that you all want to seek?
Yeah, thank you for that very much so. So we are part of the larger Food as Medicine movement as part of Root Cause Coalition, a variety of other organizations around the United States, and we're a leader in that. I'll actually be presenting in Kansas City on the stage around Food as Medicine in a month. But absolutely, I think, from a competitor standpoint, there are very few trying to do national solutions. There are those who are doing very localized last mile work, but when you talk about actually being responsible for helping drive the cost of care and the actual improved outcomes in those communities, when we think about the social determinants of health and actually really managing that side while the partner handles the clinical side and bring those two together, I think you'll find there's very few folks who are actually committing to doing that level of work. But thank you, though. Actually, now I got some more to go look at. Thanks so much.
We have time for one more?
Yeah.
Are you doing anything to help influence the patient outcome after the meal consumption and after they leave the facility? Can you
Yes.
talk about that?
Yeah, absolutely. So again, it depends on who the partner is. But in the case of, let's just say, one of our maternal health programs is actually around postpartum mothers and providing them our food waste solution and the nutrition that they would need for about 8 weeks is what Ascension is doing in that program. But part of that is also the education component over that time frame and engaging them and keeping them completely engaged in the program. And that's exactly what Foodways is about, the very definition of Foodways. So there's absolute responsibility there. In some organizations, it becomes a question around sustainability and long-term sustainability. So even after that 8 weeks, what does it look like for the mother for a year? And we're also engaging them a little bit on some of the digital programming and experiences even after technically a program ends. Absolutely.
Are you connected? There's a rapidly, thank goodness, growing movement of birth centers, especially women of color-led birth centers across the country, like Leslie and Birth Justice and Birth Equity. Are you plugged into that birth
Yeah, actually
center?
we are. We're actually planning, one, she's referring to in some ways, the development.
We need to wrap this up. So if you'll just do just real quick answer.
Oh, yeah, sure. So around doula programs, nutrition programs, absolutely. Definitely in Austin with Black Mamas ATX. Actually, the organization we'll be working with in Louisville, Kentucky is actually a doula organization trying to put the nutritional doula in the organization for them and the long-term a nutrition strategy in order to be able to achieve outcomes, improved outcomes, and particularly in black mothers and black communities. Absolutely.
Thank you so much.
Thank you,
Appreciate you. Okay, so clearly I might have ADHD. Let's bring our ADHD First Then back up for some Q&A.
Hello again. Hello, judges.
Hi, and thank you so much. Really appreciated your
Sure.
presentation.
Thank you.
I had a question with starting direct to families. If you could just tell us a little bit more about your marketing strategy for that.
Sure. So as the mom of a child with ADHD, we are really motivated to try to help solve problems for families as soon as we can. And so our thought, and also watching market trends right now with other digital therapeutics, is that we launch direct to families first, start solving problems and relieving pains, and also use that as an opportunity to build some recognition, continue to build important data set, which is really key to our intellectual property and kind of part of our secret sauce. And while we do that, we're continuing to build the data that we need to talk to health systems and payers and providers and self-funded employers to really demonstrate and show the data of the efficacy of our solution.
Can you talk about how this has been implemented either in your family or any pilots that have been done? What kind of results are you seeing?
So the way we got started, we're working on version 1 of our kind of full MVP right now and expect to be in pilot in partnership with a large independent network of primary care providers in the first part of 2024. But we started our journey by building a very narrowly defined web app to test some of our ideas about what would it look like to take known science-based interventions and deliver them to families in a self-guided way. And so we actually had a bunch of moms from across the country join us in kind of our customer discovery and initial research effort and get on an app and play with it and give us some really good feedback that gave us enough insight to say, quit your full-time job and do this full-time and begin to raise resources and build the team of experts that we need. I know what I know, and I also know what I don't know. So building that multidisciplinary team to really move forward to kind of the first real version that's out in testing was important.
I'd love to connect you with Scott Cusino. He exited, but he co-founded MyStrength. And what's super interesting is he did a B2C model with education for a for-profit university before he started MyStrength, and he went straight to B2B. And he took licensed behavioral health content, and it was super interesting talking about the health conversion foundations. The Colorado Health Foundation invested in 7 tech companies in 2010, 11, 12. Only one of them did revenue-based financing, and that was his company. It's the only one that's still alive today and exited at a 4x return. And so he then co-founded another youth behavioral health app. So he already has a lot of the relationships that could help you speed up or potentially joint venture and go to your to get to market faster. It sounds like do you have the funding you need? Can you explain more with the SBIR grant? Like, where are you at with the funding? What would this additional funding be for you if you got it?
Sure. So I built my first career in the nonprofit sector, so we're really good at doing a lot with a little. And so we've been operating on that strategy up to now, which is how do we build the best first version of First Then for families and be able to test that. Truly kind of the startup MVP mindset. The game-changing part of receiving this National Science Foundation grant is that it allows us to accelerate and deepen the work that we do and really come out with more serious testing than we might have been able to do otherwise. So being able to conduct a full pilot, being able to really demonstrate and show the results of what we're doing is super important to us. That funding helps us with all of the R&D that is still in process. What that funding doesn't do is support thinking about marketing and commercialization and really making sure that we've got kind of that right product market and product user fit.
Thank you so much. Those are our questions for you.
Thank you very much.
Thank you. Now, judges, if you will, take your leave and go back and deliberate. We've got someone, while they're doing that, we've got last year's winner coming up on the stage. His name is Chris Heckler. He's going to talk a little bit about what his company is and what he's been doing since we last saw him last year. Fresh is the name of the company. It's a fintech platform, and it is for organizations providing services to those involved or impacted by the justice system. So Chris is going to talk to us for a minute, and we're going to learn more about what he's doing to change generational poverty to generational wealth. Take it away, Chris.
Awesome. Thank you so much. Wow. I was up here last year. It's very difficult to do what they did. I can tell you that. And I think I like all three of the companies personally. My oldest son's got ADHD. Definitely we're struggling with that. He's a freshman. So changing into high school with all that is really challenging. And then all my kids and my wife got lice recently. So I can't wait to tell her about that. And then I obviously need nutritional help. As a lot of us do. But I'm not here to tell too many jokes, even though my last name's Heckler. I'll try to keep it light as possible. Typically, you would see one of my co-founders, which the slides are not up anymore, but Dr. Topeka K. Sam. She's one of the most well-known women in the justice-impacted space. She's worked with all the different presidents. She's got a presidential pardon. She's a mover and shaker in the industry, and I wish she was here. I was texting her backstage. So her and my other co-founder, Danny Feldman, are in New York right now working on a strategic partnership with another bank. We are a fintech company, and we are 100% focused on the justice-impacted space. So there's, I'm not sure, so typically when I'm up here talking, I'm talking to people who know the justice-impacted space. So just in case you're not as familiar with that, there are 20 million Americans who have felony convictions in America, and there's 70 million that have some sort of criminal background, including misdemeanors or any kind of running with the law. We're really focused on that 20 million because the 20 million are the ones that, even though they served their time and have come out, it could be for any kind of offense, anything that has a felony conviction on it, they are permanently impacted, right? So it really is a life sentence. All three of us as founders are all justice impacted ourselves, all from different things at different levels at different times, and we've all faced different types of hurdles. And as I have dived deep into this space over the last 2.5 years, I've learned a lot, and I'm from this area, and it's been really sad to know that the area that you grew up in really intentionally divided demographics, economic resources, all sorts of things to, back then, really intentionally disenfranchise a whole population. And that stuck with the financial institutions forever. So laws that were created and rules that were created in the 50s and 60s have stayed. And they're not really lightening up. There are some banks now that are trying to kind of make it a little bit easier for people to get bank accounts and whatnot. But what we realized is that everyone needs a fresh start, and no matter what you do, right? And so it doesn't matter how much money you have. So this is one of the things that was eye-opening to me. One of my business partners, very successful, very involved in Dallas, very successful with a startup community, grew a very large company and sold it. He still has to rent his house. He can't get a mortgage. He has to pay a lot higher interest rates than anyone else who doesn't have a felony conviction. And that happened when he was 17 years old. And he's probably 38 now. So I don't think I realize, and a lot of us don't realize, that it doesn't fall off after like 7 years. And if you pay to have it scrubbed or whatever they call it, it really does stay on your record permanently. And I just think that's wrong. And so I got really, really involved in it and got involved with my church and started pushing, like, how can we help? And the first thing, we talked to a lot of people who write books in this space, and luckily we were able to get a hold of them. And this industry is very small. There's, literally probably 20 different companies that are doing something in the technology space for the justice impacted industry. And all of us got together, and it's like, okay, what do they really need when they come out of prison? And it's really access to anything, access to stuff that we take for granted on a daily basis. access to banking is one of the hardest things, and one of the leading indicators for recidivism is not having a bank account. Because you come out of prison and you may or may not get $50, $100, and whatever money you put into it when you went into there. They usually put that on a check. They might put it on a prepaid card, but that prepaid card, coming from a company I won't mention, who pretty much runs all the banking and stuff inside prisons, is what I would call predatory, right? And so, it's predatory on fees, and it's also predatory on I would say for taking advantage of uneducated people when it comes to finance. In the fine print, they're taking $5 a week out of that prepaid card. Well, if you have $50 on that prepaid card, you might put that in your pocket thinking that when I take my bus ticket back home out of prison, I have $50 and I'll figure out, how to get a cell phone, how to do different things with that. Well, that might be $40 now, and the longer I wait, it could be less and less. And then so when you show up, you've got egg on your face thinking, oh, I thought I had $50. And that $5 a week or $3 a week, that's like 50% interest rates, right? These are insanely high interest rates that we would never pay, that it should be criminal. There's a whole bunch of things, and a lot of really good people really focused on DC and trying to get predatory interest rates and stuff taken out of the system. But until then, we decided to create a free, which on our website you're not allowed to say free, which is just another roadblock for the industry. It says no cost. There is no cost to the user. We took down every single roadblock you could possibly imagine, and it's been very, very difficult, right? It's been, we run into roadblocks from the banking institutions and everyone else you can imagine just by saying we want to give this away for free. We believe everyone deserves a free checking account. Well, our whole policy is to keep people with felons or keep people with felony convictions out of the bank. Like those are the bad people. It's like, no, they did their time. And by the way, you're lumping all felons as like they're all murderers. And that's the problem in America, is that we treat everyone you just check a box. You have a felony conviction, yes or no? Not what did you do, when was it, did you do your time, are you on probation? All these different things that really separate the levels of crime, and the hiring and banks and everything else, they all just check a box. And if you check that felony conviction box, they might give you a bank account because they're legally required to in that state, because it's done by the state, but they're going to charge you $15 a month for accessing your own money, which none of us ever have to pay. You might be able to get a loan, but they're going to max out the interest rate, even if you put in the down payment and everything else that everyone else does. They're going to take advantage of you because you have no other option. So Fresh stepped in to try to be another option for people. We work with all the nonprofits. We're really big in New York. We're spreading across the country. You can download an app. You can download it right now, MyFresh, on either Android or Apple. Create an account, get a free debit card. We also offer now health insurance. And so we partner with a company called Parks Insurance. They're an agency, and they specialize in helping people who are coming out of prison get access to free health care, because that's another major, major issue. And then even if you've been out of prison or you've never been to prison, you can get very affordable health care. So they kind of help navigate that whole insurance process for people, because it's very, very confusing, as we all know. And if you don't have a job that gives you insurance, sometimes you just don't even know where to start. Even if you go to healthcare.gov, it's like, whoa, what am I looking at here? What am I trying to do? So they've made it very, very easy. Another thing Fresh does is we provide free financial education on I would say, probably 60,000 tablets now inside prisons. That's one of our biggest impacts that we provide. We wrote a really kind of not even a financial 101. It's kind of like financial 001, because we keep having to revise it, because a lot of people, you get feedback from the wardens or whoever who are actually trying to help, but they'll say hey, people don't even know, when you say checking account, they don't necessarily even know what you're talking about. So we had to step back and really think through it, because a lot of people, and this kind of, when they get released, they actually think that they are banked. Oh, who's your bank? Oh, I use the check cashing place at the liquor store. I was like, well, that's not a bank. You know, it's like they're charging 13% fees, right? And they don't know that. They don't realize that no one else is doing that. They think that's normal. Their parents might have done that. Their friends do that. And so we're trying to educate people, being like, this is your money. You need to keep as much of it as you can, and don't fall for predatory things. There's been, we have a whole other side of our company that's a nonprofit side. So if anybody wants to donate money to help this cause, feel free to reach out to me.
Chris,
yeah.
I have one question for you, or
Yeah,
one comment for you, and we've kind of run out of time. So you've got a number of nonprofits in this room from all over the country.
Yep.
And many of them may want to come talk to you after this.
Okay.
Because they may touch some of the populations, or they may touch some of the families of the populations that you guys are serving. So I just want to say that. So let's give a round of applause for Chris. Thank you so much for what you're doing. We appreciate it. All right, so we have deliberations have been completed, and we are going to bring the judges and the contestants back up to the stage. And I will say, I'm so pleased with all of our 3 pitch contestants this year. Very tangible. All of you, I don't know about you, but I could relate to, 2, 3, all of them are very tangible for me, so we really appreciate that. I want to say a big thank you to John Dupree, who's run this whole process. He's the chair of our Portfolio Review Committee at SVP, and this is Tony Fleo. Make sure they're around. We made them go outside a back door so they couldn't hear the judges deliberating. They're ready?
Give a shout out to Bob Appel, who chairs our, and just explain a little bit about the structure.
Sure. I'd also like to give a shout out to Bob Appel. Bob is chair of our for-profit entity that holds the equity in these companies that we have funded. Thank you, Bob, for being here. We appreciate you. All right. It's my pleasure to announce this year's winner. It is FreezeKnit.
Just want to congratulate FreezeKnit, but thank all of our participants who pitched today. We know that you have done extraordinary work. We are here to support you in a lot of ways as you go forward, so thank you for that. Thank you to our judges who did a fantastic job for us, stepping up and evaluating and deliberating in the back. But most importantly, thanks to the social venture partners who made a shift 7 years ago from understanding that you can have great impact in giving grants to nonprofits, but you can also have great impact in making financial investments in for-profit for good companies. If you're not currently in that space and want to know how to do that, Bob Appel's the expert. He's in the audience. Heather's here, and I know a little bit about how to push people to get it done. So if you want to give it a whirl, feel free to have a chat. I want to thank my SVP team as well for helping to put this all together. So thank you, folks, for being here this morning.